This is a very popular topic, so I'm going to try to get all of our questions in, but I'm sure we'll miss something. How often is migraine confused for sinus headache, and why?
Well, it's very often confused for sinus headaches, and there's a couple of reasons. One is the location of migraine is often overlying the sinuses, so it involves the forehead, can involve the cheekbones, so the frontal sinus, the maxillary sinus, and then between the eyes. And then migraine can produce some sinus-like symptoms. So you can get runny nose, you can get postnasal drip, you can get nasal congestion during a migraine attack. And sometimes that can confuse patients in terms of what kind of, whether they have either sinus headache or they have migraine.
In addition to confusing patients, can this also confuse physicians who are not headache specialists?
Absolutely. So they've actually done studies where they've taken people who have an established diagnosis of sinus headache, and then they've actually had headache physicians or headache interviewers basically ask them all the questions of migraine. And anywhere from like 85 to 90% of people that thought they had sinus headaches actually had migraine. So it's something that is a common misconception amongst patients and physicians. So many times when people think they have sinus headaches, they actually have a migraine.
So if you know someone in your life who has complained about sinus headaches off and on for years, it might be worth them speaking to a headache specialist just to determine whether it really is related to their sinuses.
Yes, but I think there's a lot of misconceptions about how, the sinuses and allergies and so forth can influence migraine. So just because you think you've got a sinus and many times you meet migraine criteria, doesn't necessarily mean that sinus and allergies don't impact migraine. They often coexist because they are what they call comorbid disorders. So they're more likely to be seen with one another. So they kind of are like, they commonly accompany one another. That's a good way to put it.
Is it kind of like the chicken and the egg? What comes first, the sinus issue causing the migraine or a migraine attack causing the sinus issues? Or does it not matter?
Well, I think it depends. I think if you have a migraine attack and you develop sinus symptoms, so you develop a runny nose or tearing of the eyes and so forth, and it just occurs primarily with a migraine attack, then those symptoms are probably migraine related. On the other hand, if your headaches get worse during either the spring or fall, and you know that you've got, say, allergies to tree pollens and your headaches worsen during the spring, and it's a persistent thing over several weeks or a month, and it seems to correlate with high pollen counts, then it's probably migraine, but it's probably migraine being triggered by sinus. So there's probably a complex interrelationship between these two disorders.
So we've touched upon what symptoms are the same between sinus headaches and migraine. What symptoms are different between the two conditions?
Well, if you have migraine, you're going to have, a number of different things. You'll have a moderate to severe headache. The headache is often one-sided, but it can be a two-sided headache as well. And you tend to have very specific, what they call associated symptoms. And those include things like sensitivity to light, sensitivity to noise, nausea. And then some migraine patients, anywhere from 15 to 30%, can have something called an aura. So a visual aura is where you have little flashing lights or zigzaggy lines that start off small and then gradually enlarge in your vision. It typically lasts anywhere from 5 minutes up to an hour. You can also have a sensory aura where you get little pins and needles that start one, like say in your face and march down your arm and then maybe down your leg. There's even one where you get actually motor symptoms where you get weak on one side of your body. If that happens, even though it may be a migraine, I'd still, you have to worry about things like stroke and so forth. But fortunately, that's not a very common, type of aura. So those are the differences. So if you start having like any nausea, sensitivity to light, noise, moderate to severe headaches, you probably have migraine. You could still have sinus, and you can still have allergies, and those could still be interplaying with the migraine. But if you have those symptoms, you probably have migraine, and that's thought to be a genetic condition.
Do any of the treatments overlap for sinus issues and migraine?
Not really. Most of the migraine therapies either acutely or preventively are not therapies that you would typically give for sinus or allergy. So sinus or allergy therapies are going to either be like antihistamines, nasal sprays. Sometimes there's a pill called montelukast, trade name for that is Singular in the United States. Can often be used for allergic disease. Those are not